Welcome to Forbes Newsroom. Joining me now is Forbes contributor, Dr. Nina Shapiro. Dr. Shapiro, thank you so much for joining me today.
Great to be here.
Great to have you. So you wrote for Forbes recently that the U.S. is already in the midst of one of the roughest seasons for winter illnesses. Can you explain why now is so brutal?
Right. So we are in something that we call a tripledemic, and this is early in the winter season, and we're not even hitting winter yet. And we are seeing major hospital surges, primarily with children, but also with adults, with three respiratory viruses hitting us all at once. Very early. This started in the fall, and it's continuing now into the early winter, and we unfortunately don't really know where it's going to go.
Why do you usually see a surge of these types of illnesses in the winter?
So the winter viruses that we typically see are influenza or flu and something called RSV, which is not a new virus. It's been around since the 1950s or maybe even earlier. And RSV, which is respiratory syncytial virus, is a virus that typically affects young babies. So babies under 6 months, maybe early toddler years, but it typically affects very young infants. And infants are hospitalized every year, but more commonly in the winter months, late winter, sometimes early spring. So that's what we see typically. And this year we saw it last spring, late spring, and now we're seeing it again in the early fall, and certainly now into the early pre-holiday season. Flu is also back with a vengeance. We didn't see a lot of flu in the last few years, primarily due to all of the COVID restrictions and mitigations that we had. We didn't see a lot of flu and a lot of flu complications. But this year also, we're seeing the flu very early. It typically starts in the winter months into the late winter, early spring, but now we're seeing it late fall, early winter.
A word that we've been hearing recently is tripledemic. So is that a totally unprecedented?
So a tripledemic is a term that we haven't used in the past, and the triple is COVID-19, influenza, and RSV. And they are all, at this point, not new viruses, but the thing is, they're hitting us all at once. They're not really a season for each of them, but we're seeing all three viruses affect the population at the same time. And they all have very similar presentations, very similar symptoms. So oftentimes it's hard to tell which one you have. So subtle differences. So RSV typically affects young children, although we are seeing adults now with RSV, and even some adults are getting hospitalized with RSV. So RSV is typically a cold type virus. So runny nose, stuffy nose, wet cough. That's very common, sometimes a low-grade fever. But in the babies, and now again, older children and adults, it can start causing breathing problems. So wheezing, difficulty breathing, deep cough, something called retractions, where they're using their extra muscles to breathe. So respiratory distress, turning blue. So those are all extreme cases of RSV. But RSV typically is just like a cold virus and presents very similarly to any sort of winter cold that we've had years and years. Flu or influenza tends to hit hard and fast. So this is the time where people typically would describe themselves as feeling like they're getting hit by a truck. Mm-hmm. So they have a high fever, body aches, they can't get out of bed, just feeling terrible. They can also have the associated sore throat, stuffy nose, but it's really just an overall feeling awful. And COVID, as we know, over all these 2.5, almost 3 years that we've had it, can be a million different things. Fever, sore throat, loss of sense of smell, body aches, feeling terrible. There's the gamut of symptoms with COVID-19, but a lot of them do overlap with RSV and flu.
Out of the three that we're seeing this season, which one is the worst?
Worse is a tricky term. So, I still, COVID is the worst in many ways because of long COVID. I think that's really, really still concerning. COVID is still killing 300 people a day in this country. So in that way, COVID is still a number one concern. The worst right now is RSV is filling hospitals, and it's filling pediatric hospitals where states such as Colorado have barely any pediatric ICU beds in the entire state. And with that, it's not only that the hospitals are filled with sick babies, that means that children who need what we would call elective or non-emergency procedures can't have them done. So many hospitals have started canceling surgeries, canceling elective admissions, canceling non-urgent procedures, delaying care because there are no beds in hospitals. So that's really an overall healthcare, widespread health system concern. I think number one right now is RSV. Flu is very dangerous. In years past, we would see 20 to 50,000 deaths per year in this country alone from influenza complications. So that's still a very serious virus. The thing about flu is that we do have a vaccine to prevent getting sick and prevent serious complications. As we know, no vaccine is perfect. The influenza vaccine, some years it's great, some years it's not so great. We don't usually know until the following year how effective the vaccine is going to be. But flu is, does have that layer of protection as opposed to RSV, which does not.
The hospitalization surges with RSV is certainly concerning. So is there a way to treat this before it gets to the point of going to the hospital?
So RSV can be treated at home, just as you would treat other cold symptoms with cold medications, fever reducing, hydration. But if it's a child with breathing problems, that really is something that needs to be addressed in a hospital. Obviously, if a child is sick, we recommend that they not go to school or daycare or preschool to infect other children. So reducing the spread, just as with any other virus, will protect other children from getting sick as well. But there's no antibiotic that will help treat RSV. It's really just treating the symptoms as they come.
And how do you reduce the risk of spread of these illnesses?
So reducing risk of any sort of infectious disease is pretty similar across the board. Hand washing, staying home if you're sick, not exposing other people to an illness that you have or your family has, and masking. Certainly indoor masking in large crowds in winter seasons is something to be strongly considered. That does protect the person wearing the mask. It does protect the people around them. So while masks are not mandated, it is still something to strongly consider when you're in large crowds this winter season.
So let's say you contract one of these illnesses that comprise of the tripledemic. How long are you down for the count for each?
So on an RSV infection, an uncomplicated RSV infection can be 3 to 5 days, can be pretty short, just like a cold. And most people who have RSV, whether it's a child, an infant, or an adult, they don't even know they had it because it just seems like a regular cold. A lot of doctors don't even recommend testing for RSV because that's not going to change the management. If your child has RSV, you treat the symptoms. If they're sick, you come into the hospital. But again, most RSV infections just last a few days, certainly under a week. A flu infection can last about a week, sometimes 5 to 7 days of feeling really, really under the weather, high fever, body aches, weakness, fatigue, sore throat. And COVID, as we know, can last anywhere from 2 days, can be asymptomatic, and it can last months. That's the big unknown virus still, is that there's so much variability on how people respond to the illness.
And how long do you think that this tripledemic is going to last?
So we really don't know how long this tripledemic will last. Some data have shown that the new hospitalizations for RSV may have peaked. That doesn't mean that the hospital beds are open, because kids who are hospitalized for RSV may be there for anywhere from 4 days to several weeks. But if the new hospitalizations have peaked for RSV, we may start to see a decline in hospitalizations, and then hopefully the season will end sooner than typical. The flu is also peaking early. Typically, the flu peaks in January, February in many states, even later in some of the southern states. If that's peaking earlier, it may end earlier. COVID, we don't really know. We can't really say that there's a season anymore because we've had summer surges, spring surges, winter surges, fall surges. So COVID, we don't really know, but hopefully this tripledemic will end sooner rather than later. All we can do is hope and that keep everybody healthy. There are vaccines for COVID, there are vaccines for flu out there, and ways to protect against RSV is really just basic ways that we would protect against any other infectious disease.
Dr. Nina Shapiro, thank you so much.
Thank you.